have you here today. So my name is Lacey Brown. I'm a gerontologist from SDSU Extension. My co-presenter is Chelsea Byers. She is a family life educator with Illinois Extension. We are grateful for your interest in this webinar. Before we begin, let's go over a few housekeeping things. This webinar is being recorded. It will be hosted on the incran.org website in the next 2 weeks or so. If you have questions along the way, please feel free to type them in the chat box, and we'll likely cover those at the end. So on the next slide, we have the learning objectives for today's webinar. By the end of this presentation, you will be familiar with gerontology. You'll be introduced to ageism and its consequences. Chelsea and I will provide details about the Scholarship in Family Consumer Science Decade in Review project and what we found. We will close this presentation with a discussion to explore existing efforts to address the content gaps identified during our project. I would like to review a few key terms that we will be using throughout the presentation today. Older adult typically refers to a person who is age 65 and older. Gerontology is a social science that focuses on the biological, sociological, and psychological aspects of the aging process. Population pyramids are tools that are used to visualize two variables, age and sex. This helps us see the age and sex distribution across the population. Population aging refers to an increase in the median age of the population due to declining fertility rates and rising life expectancy. Family and consumer science is a field of study that focuses on issues that affect individuals, families, and communities, especially issues that relate to basic needs of food, shelter, clothing, and relationships. The Wellness Wheel, developed by the Substance Abuse and Mental Health Service Administration, is a model that shows the 8 dimensions of wellness in an easy, simple to understand way. Before Chelsea provides details about the project, I would like to review some important background information. You may not be able to see the number on the license plate, but it says 1923. This photo was taken nearly 100 years ago. It's difficult for us to imagine what life was like back then. What I can tell you for certain is that there were a lot less gray heads running around our communities. The graphic on the next slide provides a good visual of how much the age composition has changed in the past 100 years. On the screen, you see 3 population pyramids, one for 1900, the second for 1950, and the third for 2000. The percentage of the population that was male is presented on the left of each pyramid, and women are shown on the right. What's interesting is that estimates suggest for most of human history that the age and sex distribution looked like the pyramid from 1900. For example, in 1900, more than half of the population was younger than age 24. By the end of the 20th century, that number had declined to 35%, about 1 in 3. There were also changes in the population of adults age 65 and older. In 1900, only 4% of the whole population was age 65 and older. That number increased to 12.4% in the year 2000. By the year 2030, projections suggest that 1 in 5 Americans will be age 65 and older. So what happened? I'd like you to take a moment and type some comments in the box for me. So what happened during the 20th century that led to those major changes in the population composition? The baby boom, okay. So the baby boomers were born. Better healthcare, disease prevention and management. How we go to war, did the war affect it? Modern day medicine, science advancements, vaccinations, nutrition advancements, birth control, economy, smaller families. You guys really have nailed some of the things that have happened, but I want to provide a little bit more context. So many of the things that we take for granted today were not available for most of human history. So let's talk about sanitation and clean water. Those are among the most significant changes that took place in the 20th century. The first sanitary landfill, we take it for granted. The first sanitary landfill was not built until 1937. That's less than 100 years ago. And when I'm talking sanitary landfill, I'm talking about where they put a lining on the bottom so the seepage doesn't get into the drinking water. Someone commented on the baby boom generation. The thing about the baby boom generation that's not always talked about is it's really the timing of their birth that was so important. Because by the late 1940s, and the boomers started being born in 1946, by the late 1940s, scientific knowledge had developed enough so that large-scale vaccine production was possible and disease control efforts could begin in earnest. So what I really think the baby boomers will go down in history for when we really talk about it in the future is their timing of their birth with all these scientific advancements that took place. Here's another one we take for granted, antibiotics. The first antibiotics was developed to treat syphilis in 1909. By 1944, the US military was using penicillin widely. Hand washing. Now we've all heard a lot about hand washing lately. But here's the funny thing is Dr. Semmelweis, who first recommended hand washing in 1846, because he was concerned about the number of children and women who were dying in childbirth. And as he observed and watched, what he realized is that doctors were performing autopsies on dead bodies in the morning and then going to help women have babies. And he said, we should wash our hands. Unfortunately, the prevailing notions of the time led to his recommendations not being followed. It's also important to note that Florence Nightingale was an advocate for hand washing. And what's striking about hand washing is it was not until the 1980s when a string of foodborne outbreaks and healthcare-associated infections led to public concern in the United States. And they identified hand washing as a key thing that needed to be done. Other factors include improved access to food, birth control, family planning, refrigeration, pasteurization, and other advancements that reduce the risk of being exposed to an infectious disease. Because what's important to know is that most people died before they could even reach adulthood for most of human history. With the dramatic increase in the number of older people in our communities, should we be concerned? There's not a simple yes or no answer to this question. Before I address this question, it's important to make sure we all are on the same page about what aging is and what it is not. Primarily, aging is just the changes that happen to our body as a result of the passage of time. Gray hair, wrinkles, changes in reaction time, changes in vision. Those are age-related changes to the body. Dementia, heart disease, diabetes, and other chronic diseases are not inevitable outcomes of getting older. In fact, the research says those age-related changes do not always lead to disability. Many adults enjoy active and engaged lives until shortly before their time ends. So why do so many people believe that disease and disability is an expected part of the aging process? Many of us hold beliefs about people based on their age. We make assumptions about their skills and their abilities based on how old they are. All of us are taught age-appropriate behaviors. For example, families are started in your 20s and 30s, and people near 65 are expected to be retired or retiring soon. And while I will focus on the ageism that affects older people, younger people experience ageism too. One survey found that employers are reluctant to hire people under 30 because they're unpredictable and they don't know how to work. Another study published in the Human Resource Management Journal found that discrimination for being too young is at least as common for discrimination for being too old. The difference between the ageism we experience as younger people and older people is very different and very important. We typically grow out of the stereotypes associated with youth and grow into the stereotypes associated with aging. So what are the consequences of ageism? Research indicates that 1 out of every $7 spent on the most costly health conditions can be attributed to ageism. Ageism has been shown to predict physical functioning, subjective health, functional status, cardiovascular health, cognition, recovery from health events, and a whole host of outcomes in older adults. So who's at greater risk of internalizing these negative stereotypes about aging? So individuals with a tendency to neuroticism. These are folks who generally see the world as distressing and threatening. Individuals who are socially, economically disadvantaged typically have worse views on aging. People who watch more television have worse views on aging. People with a family history of Alzheimer's disease have worse views on aging. And then professionals who work with the sickest older adults. So we're talking about adults who may be working in a nursing home where we're dealing with adults that have significant health stuff. So the total annual cost of ageism is expected to be $63 billion. That's a significant cost for the attitudes and beliefs that people have about getting older. The consequences of ageism are what motivated Chelsea and I to pursue this project. Before I turn the microphone over to her, I want to provide a brief summary of what the research says about aging and outcomes in older age. So ecological systems theory posits that human development occurs in a variety of different environments or systems throughout the entire lifespan. The diagram on the screen shows the individual at the center. Each level represents different levels of interaction, and they all play a role. And that ageism falls in that outer ring. But I want to really draw your attention to that arrow at the bottom. I mentioned earlier about the baby boom generation, and they're the ones who get a lot of airtime when we're talking about aging. As I shared, their birth time was really serendipitous because they were born when we had made some significant public health advancements in our communities. My hypothesis about the baby generation is that they will be recorded in our history books as the last generation of children born to large families. And a lot of that's related to the fact that we have more family planning and birth control than we did in the past. On the screen on the right, you see a list of characteristics that affect outcomes in older age. I don't have time to go into each one of these characteristics, but the key takeaway here is how we age is a complex iteration between our personal traits and characteristics and where we live. Chelsea will now tell you more about our project.
All right, thank you, Lisi, for that overview. So now I'm going to quickly kind of just go over what Lisi and I did for this journal publication, and then we're going to actually spend a chunk of our time together having conversations with you guys on what's being done in your respective states and where do we go from here. So, you know, how do we start this? What kind of got us on this track? So the Journal of FCS put out a focused call for proposals that would focus on FCS and related scholarship during the past 10 years. So looking at 2010 to 2019. The general purpose then was to synthesize FCS scholarship that has been produced during this time in a specific content area. And since Lisi and I are both gerontologists, clearly we chose the area of gerontology. So we were challenged with looking at the following questions to kind of guide our review. So we looked at what research has been published in this period. So, you know, like what kind of body of knowledge, what common FCS practices, you know, just kind of like what has been done in the area of gerontology. What key themes kind of emerged across the research? what aspects of the content have been overlooked. So what were the gaps? And then what was worthy of more attention? And then what trends appear to be forming that might lead into the next decade of scholarship in this area? So that's what we're going to kind of go over. But first I want to talk about how we did our review. So looking here, we looked at 2 journals. So we looked at the last 10 years in both the Family and Consumer Sciences Journal and the Family and Consumer Sciences Research Journal, or yes. And so, and our approach was to look at all the themes and interpret the underlying content, and then kind of do a summative content analysis of anything that was done in the area of gerontology. But first, just kind of polling you guys, does anybody receive or read either of these professional journals? You can throw that in the chat box. Ruth, I feel you there. Sometimes I look for them and then sometimes I'm like, oh, there's just not enough time. Yes, I think as professionals, you know, we have these journals at our ready and you know, there's lots of good information in there. Yes, generations too. Yeah, there's lots of information out there. Well, I'm going to tell you what we found in looking at the last 10 years. So here we go. So what we did to find the articles is we did just a general search looking at the last 10 years, and we searched for terms such as aging, elderly, older adult, senior, retirement, kind of any kind of terms that might pull out articles that we were looking for. And then what we did is we kind of, after we did that article search, we came up with 84 journal articles in our initial search. Then, and if you think about that, 84 articles from 2 journals from 10 years. So that's all we found. So we'll start with that. We then screened the abstracts to determine which articles then merited like a full review, because, you know, some of them might have been more lifespan geared. They really weren't focused on gerontology. They just might have mentioned something about somebody older, and so it pulled that article, but it really didn't have a gerontology or older adult focus. So after really screening the articles more in depth, 15 of those articles got thrown out. So we were down to 69 articles. So these 69 articles then were fully assessed by each of us individually. And then we looked at these articles to identify themes. And when I'm talking about themes, we were identifying things like, okay, this is about financial exploitation or retirement planning or aging in place, or this is about nutrition and aging. So we were identifying what the theme of these articles, the main thrust of the article was about. And so once we organized these themes, we had to decide how are we going to organize this, or what next? And so we decided to organize them within the context of the wellness wheel. And the reason we chose the wellness wheel was because, oops, go back, thank you, is because we agreed that the wellness wheel would give us a great framework to organize the articles, because while, you know, an aspect of the research might have been, a goal might have been on one certain dimension of wellness. So if you're looking at, you know, financial aspect of retirement, you know, we know that finances is not just about finances. Financial health does overlap into many domains of wellness. And so, you know, we thought the wellness wheel would be the best way for us to look at true wellness of a person's life and how we could kind of better categorize what these articles really were capturing. So here on this screen, it shows you the actual definitions of the 8 dimensions of the wellness wheel. And so I'm just going to be quiet for a moment so you can read those through. Actually, I'll read them out in case somebody just listens to this. Emotional includes feelings, emotions, self-care, and stress. Environmental includes green living, change of scenery, home and work environment. Financial includes work, checking, savings accounts, debt, retirement, and other accounts. Intellectual includes personal interest, education, brain exercise, and conversation. Occupational includes work relationships, balance, and accomplishments. Physical includes nutrition, physical activity, sleep, drug use, illicit and licit, medication safety and preventative medicine. Social includes community, new people, and social time. And spiritual includes beliefs, involvement, and time. And so as you can see, this wellness wheel encompasses the various dimensions of life of an individual. And, you know, when we think about this, we want to think about this in a way to really look at the entire person. So what we did is we took our themes that we identified and we went through and matched our themes then with the wellness wheel. So if the article was about financial exploitation, we categorized it under, you know, emotional and financial. Or if it was about caregiving, it might have gotten emotional, social, and physical. And so the right figure here is just a small snapshot of all the 69 articles that we coded, but I just wanted to kind of show you kind of the process that we went through. Over half of the articles had dual or triple wellness dimension classifications. So as you can see, you know, this was a tedious process, but it was a very enlightening process for us. 3 of the reviews encompassed at least 4 or more of the dimensions of wellness. And, you know, the framework was identified as a great way, though, for us to organize these themes found within the Family Consumer Science Journal and the Family Consumer Science Research Journal, because it did give us a great structure to organize our content. Just some things to note from all of the articles we did look at. Of the 69 articles, it should be noted that 6 of them were book reviews on aging issues, 2 were research briefs, 1 was solely focused on demographic trends in aging in the United States, 1 addressed kind of coalition building and dissemination of educational resources to older adults. So 2 of these kind of addressed more system level issues, so they were really not assigned any dimensions of wellness. So this graph here shows you an overall breakdown of how the different themes were then coded in total. So if you look at this, if you added them up, it would definitely exceed 69, again, because multiple of them had more than 1 coding. And so if you take note of this graph, you can see that financial had the most. It had nearly half of all of the articles had a financial focus. So some of the common financial themes included retirement, retirement planning, financial exploitation, life insurance, the correlation between financial behaviors and perceived health or health behaviors. The second highest was the emotional. A lot of the focus under emotional included caregiving and then relationships. The third was the environmental, and this one covered things like aging in place, housing, universal design, and intergenerational and multi-generational households. The final dimension that was addressed that we highlighted was physical with 17. 2 common themes included nutrition and health conditions. So I'm pretty sure none of these are too surprising for anybody. Does any, as I mentioned these to you all in the chat box, does anything surprise you? Do you see anything that is missing? Anything that grabs your attention from this information? Not seeing any comments. So I highlighted here kind of the top 5. So I also added social in here because I feel like there was a pretty high number of social as well. There's a pretty big gap between social and next highest was intellectual. So if we look at the 3 lowest, the 3 lowest are intellectual, occupational, and spiritual. So when we think about these, we would like to highlight these a little bit more when we have further discussions later. You know, Yeah, I agree, Greta. I'm disappointed that older adults don't spend as much time learning new things. And it's not that they're not, it's that there's no research on it. So we're highlighting what the research is on. And so, yeah, that's what we're looking at, is what is the gaps in the research out there. So it's not that it's not happening, it's that we're not researching it or reporting on what's being done. And so that's why we found this as an interesting review. So yeah, we do want to talk about these because we do think that there's a lot to be had in intellectual, spiritual, and occupational wellness as we age. So yes, good point though, good point. So looking at this one, oh yes, Sherry, yes, I bet the social dimension will shoot up this next year. Yeah, with all the talk about isolation, I bet there will be a lot more on social in the coming years due to our current situation. So in this stacked graph, what you're seeing here is the final part of our analysis was just to kind of look at how many articles focused on gerontology each journal had per year. So most years, each journal had at least 2 articles on gerontology. The lowest number was in 2011 with only 4 articles relevant to gerontology. However, if you want to note, in 2012 and 2016, the Family and Consumer Science Journal had no content related to gerontology at all. The most that ever appeared were 9 in 1 year, and that happened in 2013, 2017, and 2019. So I think as a discipline, you think about all the articles that are in a journal and you think about the entire year. As a gerontologist, this makes me a little sad, but we all have to think about what are we doing to further our area of study and profession. So, when you're looking at, a low of 4 and a max of 9, there's a lot we could be doing to help promote our profession. So as we look forward, some gaps that we saw, some topics that were not really highlighted in in our review were ageism, kind of resiliency and aging, and purposeful aging. And so when we think of these, Lisi talked about ageism a lot in her part of her presentation. And as we think about ageism, if we age better, then we have better attitudes for aging. We can live in a community that supports older adults. And as professionals, we need to be advocates towards this and bring awareness to combat ageism and enable that autonomy, because people will then hopefully have better lives, healthier lives. It does impact the person, their health, their financial status, all these things. So this is something we should be thinking about. When we think about resiliency, resiliency is that capacity to recover from difficulties. And as we get older, it can become a difficult time in life when they see great loss, adversity. So we want to help teach about being adaptable, being confident, having those social connections, being optimistic, teaching those coping skills. So what does that resiliency look like in our programming? What are we teaching about? And then the third one here, that purpose, having meaning, having intention. And this definitely links with that spiritual health, beliefs and involvement, occupational health, accomplishments, how do you spend your time, intellectual health, what do your interests, your challenging your brain, socialization, conversation. So, these are things that we all want to think about when we're thinking about what are we doing in our communities to engage our older adults and teach about these that will help them, age well. So I did a little bit of a gray lit review, we'll call it, to see what everybody was kind of doing out there in these realms. So I kind of searched, and my intern, I believe, is on here, Kaylee. She helped me do a search through Extension on these topics: ageism, resiliency, purposefulness, and aging, and we added volunteerism in our search. And to see what efforts are being done. And of course, this search was not all encompassing, so if something was not on somebody's website, we didn't see it. So but this does give us a little bit of a lens to look through. It did give us a little bit of a snapshot, right? So again, this is not an exhaustive search or an all-inclusive search, but this is what we did find. So if it was a program you listed on your website, or somebody wrote a blog, or you have you know, a printable sheet on a topic, we only found about 9 states had something on ageism. About 7 had something on resiliency and aging, but there's a lot on resiliency for children and resiliency in families. Now, of course, if we're starting young, that resiliency hopefully leads into resiliency and aging, but I think it's good if we have some more programs geared towards specifically resiliency in older adults. So again, there was a lot found in resiliency in children and resiliency in families, but not in resiliency in aging. There was also a lot found in resiliency in communities, also in our search, but specifically resiliency in aging, only about 7. And then when looking for purpose in aging or purposeful aging, we only found about 7 states covering that area, and volunteerism, specifically about 6, even though I know Extension is really good about promoting volunteer programs. So I know programming wise, that's huge, but to teach about the importance of volunteerism, I only found about 6. So let's look at programs that you guys might have in these areas, because we want to share you know, what's being done in other states to further this gerontological work that Extension is doing, so we can have conversation about this. Somebody's asking what category would volunteerism go in? I think it's purposeful aging, and it would probably go into like social, it would go into purpose, it would go into work. It gives people purpose, put that occupation.
I was going to say, Chelsea, my one thing I don't like about the wellness wheel is they say occupation. I would rather to say vocation.
Vocation or purpose. Yeah.
Because I think vocation, that's where volunteering would go, is that vocation, occupation, but it also could be social.
Yes. So. Yeah, and you know, there's a quote that I heard, and it will forever stick with me. I think as people get older, I heard somebody say, it's always better for people to retire to something instead of from something. And because the research shows that when people have something to do in retirement, they always fare better with their health. And if they don't have something to go to, like something purposeful to do, a lot of times their health starts to fail. And so, you know, people still need purpose. And so if they don't have a reason to get up in the morning in retirement, their health, a lot of times it correlates with their health. And so even though they're retired, they still need purpose. And so we need to continue to teach people about finding purpose, whether it's a new hobby to learn, it's volunteering, they need a reason to get up. Yeah, hobbies. It's what is my reason? Is it grandchildren? Is it, you know, what are they doing? And so we need to remember that's so important for healthy aging. And so so let's talk about some of these. So this is where we want to have time to share with you all. You know, again, I try to do some research out there to find what we could find, but so describe your efforts, you know, to address ageism. You know, what are you doing? Are you doing anything in this area? Please share so we can all learn from what you guys are doing in this space. And feel free to unmute yourself or throw it in the chat box.
Yeah, for the rest of the presentation, we're hoping you guys will share and talk with us a lot, because as Chelsea said, she looked at the website and there could be things happening behind the scenes that we're just not aware of. So we'd love to hear what you're doing.
And Lacey and I are going to share our article at the end. We'll put it in the chat box, also with our evaluation link. So we will put both of those in the chat box.
I recently was talking with some of the SNAP programming professionals in Ohio, and we were talking about this very thing. And one of the people said that she practices with her adult senior parents how to use FaceTime and how to use online grocery ordering and things like that. She practices, so it's very purposeful and intentional that she's trying to help them stay better connected, serve themselves better. And I don't know, to me, that was like a light bulb that went off, because even myself in my early 50s, I feel very limited technologically. And so as new things come out, I struggle. And I can't imagine if my parents were still alive, they would be in their late 70s, they would struggle. So I thought it was just very loving, but also very smart that she and her parents made time to practice those things.
I appreciate you bringing that up, because one of the things I think is advocacy is so huge. And even with, we have a local coalition, and it's called a senior task force here in our community. And one of the things that they're doing is, because of all of what's going on, they're like, you know, the older adults can't get on Zoom and we need to do something easy. And I fought back and I said, we're doing Zoom webinars, but we're teaching them how to access those webinars. I said, they are showing up. I said, but here are the things that we've done to enable them. And I said, we're sending out instructions with pictures. We're getting on early. So if they're having trouble, we get on early and say, come early. And then we will get on and we will walk through. And I said, you know what? They're resilient. We had somebody in the life story writing class. I think she was at session 3 or 4. And Sherry, feel free to jump in. And she could not talk. And life story writing is about sharing the stories you're writing. It's very interactive. She could never share her stories, but she kept coming because she could hear us, but she couldn't figure out how to get her microphone to work on her end. She kept coming. And then finally we're like, okay, come like a half an hour early next time. We are going to figure this out with you. And we did some background work. And then the next time we came, we're like, okay, we need you to go to this thing. You need to do this. And then we were able, and the first thing she said was, hallelujah, because we're like, we can hear you, you know. But she was resilient. She didn't give up. And I said, you know, we're all supposed to be advocates for, you know, our older population. I said, don't give up on them. I said, because then we're enabling them not to do this thing. And I said, U of I Extension and just the programs that I have had a touch in some form or fashion in the last 7 months, I've done over 60 webinars. I've either hosted, taught, helped plan, or something. We've reached over 13,000 people in the last 7 months. And I said, and a lot of those people are older adults. And I said, because and we've started to ask questions like, how familiar were you with Zoom before these? How familiar or how comfortable are you now? Because if it's a series and you do it 8 times, you get more familiar. So I'm like, we can't just say they're not going to do it or they can't do it. We have to be advocates. Yep. So thank you for bringing that up. I
just want to touch a little bit about older technology users. The cutoff age is 75. That's when you see the sharp drop off for users, because when you're dealing at age 75, once you're getting to that population, technology really wasn't part of work at that time. And a really important thing to know about people who do not use technology, one of the reasons they tell us they don't use it is it's not relevant to them. But the moment we show them Zoom and show how they can get engaged with different things, it becomes relevant. And that's the key for technology, is when you have an older adult or a non-user, how can we show that it is in fact relevant to them? Mm-hmm. So, but ageism, we want to see if anybody's doing some work in ageism. So what I've done, resiliency. Did you jump on me?
I didn't mean to. I think I accidentally hit it.
I just wanted to, I'll just talk really briefly about what a lot of us have done in the North Central region. A lot of us have done professional development for our Extension colleagues, as well as different organizations outside of Extension, because the magnitude of the problem is so great that knowledge needs to flow out to all of our communities. So that's what we have done. I know I saw something in the chat. Sherry says, in Illinois, we talk about ageism in our program. I'm positive I'm aging. And then Ruth mentions we have a coalition, Healthy Aging in Rural Towns. and members who facilitated sip and swipes. And then Ruth says, we've also successfully done virtual aging mastery program series with our participants. We're so exciting about connecting to their devices. Yes, when they find out they can communicate with their grandkids with FaceTime and Zoom, they adapt very quickly. And I think we have to get over this mindset that older adults can't learn or don't want to learn. Some don't. I've met them. Some don't, but there is, yeah, it's interesting. So you want to go to the resiliency slide?
Yeah, does anybody have anything else? Otherwise, yeah, we can move on to resiliency. But I do want to say my grandma is 92 years old and she has a smartphone and an iPad and she has vision problems and she still uses them. So where there is a will, there is a way. So go ahead.
So has anybody done any work to address resiliency in older adults? And resiliency really is, how do we adapt to some of the changes and struggles in life? And we, like Chelsea said, you know, there's a lot of work being done for resiliency in children and resiliency in families. And as I hope, you know, we've made the case that part of the challenge we face with building resiliency in aging is ageism. Because if folks believe that aging is supposed to be a downward spiral of misery and decline, how do you build resiliency? Awesome, Karen. That's wonderful. We host caregiver chats which focus on building strengths. That's awesome. And especially for our caregivers. Our caregivers, I imagine they're pulling triple duty right now with COVID-19.
Could she explain a little bit more what that is, caregiver chats? I mean, I think I know, but if she might go into a little detail.
Karen, take the mic.
Sure, thank you. Well, we started out with a World Cafe model when we could meet face to face. So we would have questions of the day and people would come together and we would, you know, find common ground, because oftentimes the caregivers felt like they were very isolated and all by themselves. Well, we can't do the face to face right now, so we're doing it via Zoom. And so we've gone into themes of the month. So last month was trick or treat, find something sweet. So it was building on the strengths of their families and what gifts kind of the strengths of what they bring. This month it's going to be on gratitude with Thanksgiving, and Christmas will be the gifts that they bring. So it's kind of building on the concepts of family strengths and resiliency. And I do a little PowerPoint with it. I sometimes find a video to offer it. So it's not just a support group, because we've got lots of support groups out there. This is more of a, give them something to chew on and to think about, and then we discuss it and how it applies in their lives. And this last month, we had 2 people that weren't able to attend, and we haven't had huge attendance. Part of it is people don't all have the technology. Plus, if their loved one is in their home with them, it's hard to talk about the caregiver experience with the loved one being right there. But I had 2 people that had taken their husbands to doctor's appointments and they didn't get back in time for the chat. They both asked for the PowerPoint so they could download it and read it and use that to think about. So like a couple months ago, we did communication skills and how to use iMessages, and gave them a formula so they can kind of practice. And the theme at that point in time was how to ask for help. So with fall coming, how can I ask for family members to help me? And they worked on that. They loved the little formula and they practiced it so they could use it with their grandkids and other family members to help them, you know, do what they're doing to care for their loved ones. So
what I love about that is you're teaching skills. So the iMessages, how to ask for help, because I think with caregiving, the hardest thing is people always say, I need help. And a lot of times people around caregivers are always like, I want to help, but I don't know how to help. And so we need people to state the need, and usually they're more likely to, you know, be able to help as they can, right? Because but we need to help give people the tools on how to make those connections. And so you're giving them those tools. And like you said, it's more than a support group. You're educating them.
Yep. Sherry says they're working on a lesson, I think. Hold on, the chat box jumped on me. They're working on a lesson in resiliency. Where'd it go? I think we are working on a building resiliency with all efforts on lessening impact of social. Oh, there it is. Currently working on a resiliency lesson to be released in 2021. But she's been inserting messages of resiliency and mindfulness in positive aging programs. That's fantastic. Sarah writes, in Wisconsin, our extension partnered with Greater Wisconsin Area on Aging Resources to offer Aging Mastery virtually. We've trained roughly 20 educators to facilitate the program throughout the state. That's fantastic. Mm-hmm. And someone asked about Aging Mastery program. There's a link to it in the chat box provided by Ruth. But that's a National Council on Aging program. I don't remember how many sessions it is. I think it's, God, the sky's the limit, I think, on that one. They have probably half a dozen different options. So are we ready to move on to our next slide?
Yeah.
So my mouse didn't work. There it goes. So describe your efforts to address purpose in older adults. So I'll go ahead and start because I've got a program that I'm working on developing. It's called a Purposeful Retirement Book Club. It's a.
Oh, I'm trying to show it.
Oh, you're trying to show the book? You got to get rid of your background.
I know. Hold on. I'm working on that.
It's a purposeful aging book. She's got to get rid of her background. And it's a 6 session series. We are in the initial pilot right now. There's the book. And Jane Strauman and I facilitate discussions based on the content that the participants read. And honestly, I'm enjoying it quite a bit. Karen, can I put you on the spot?
Yeah, it's great. I've been talking about organ recitals for the last 2 weeks.
Oh, so we'll have to put some context on organ recitals. So there's a section in the book that talks about how if we spend too much time dwelling and talking about our aches and pains, that it's really not good overall. And it's called
organ recitals.
And it's a great section of the book because it says it's not that you can't talk about your aches and pains, but if that's all you talk about, then it's really going to have a negative effect on your ability to find purpose and meaning. You know, so we're piloting our model right now, and we hope to have the second pilot done by the end of the spring. So that's one effort that's coming out of SDSU. Illinois has a bucket list program that talks about this. Anyone else working with purpose in aging?
Erin has the Keys on Aging program, which covers, I would say, probably all 3 of these areas, ageism, resiliency, and purpose, but for sure purpose. So.
And that's out of Kansas. That's out of Kansas. Yes, it does. Casey, I don't think I understand what you mean, but.
She's agreeing what I said.
Oh, yep.
Yeah.
And that's probably the one thing I mentioned earlier about how the wellness wheel says occupation. And that's kind of like I think it forgets that, you know, you don't necessarily have to be employed to have a vocation. One of the gentlemen in our Purposeful Retirement Book Club, I can't remember exactly. He's some nature guy. He knows a lot about trees. I think he worked for the Department of Forestry or something like that. So now as a retiree, he volunteers for a bunch of different conservation types of organizations. And Erin did drop the Keys to Aging in the chat box for you. Does anybody want to say anything else about purpose? So I've got a question for you. What action do you plan to take as a result of participating in this webinar? And then we'll move on to questions. So what's your action as a result of participating in this webinar?
I'm going to go back to the activities directors that I work with in local senior groups and buildings, and talk more about purposeful things that they could be doing, and talk more about the resiliency. I think sometimes we throw a bunch of programs out there that are activities, but they may not necessarily have a purpose or a purposeful end result. So I think that's something that I'd like to maybe revisit.
That sounds like a really great plan. Anybody else want to share what they want to do? And by all means, unmute yourselves. We're a small group.
In Alabama, I'm going to encourage our state program leader to support programs like this you've mentioned here with the Aging Project, Aging Mastery. We're not getting much support in that realm right now, so it's going to have to be a lobbying.
Definitely.
effort.
Well, and that, I mean, I always go back to ageism. I'm sure people get tired of me hearing about it, but ageism is so pervasive that most folks have no idea that they believe ageist things. You know, there's an implicit bias test from Harvard, Aaron, I believe. That's a really great test to kind of show some of those biases. So some of what you're dealing with may be biases that people don't know. And it's just helping people understand that, you know, aging has the capacity to be one of the most fulfilling experiences of your life. Aging has that capacity, but we have to get past the challenges. There are challenges. I mean, our bodies change.
The negativity around it.
Yep. You know, our bodies change, you know, so we have to understand those changes. We lose people we love. Our status changes. A lot happens as we get older, you know, but there's a lot of gains. I mean, for folks that have children, there's grandchildren now, you know. There's me personally at almost 40, I feel like my brain is 10 times better than it ever was when I was 20. I wouldn't go take my 20-year-old brain for nothing. And personally, I look forward to how much my brain could get better as I gain more experience. So we got some comments. I'm doing information sheets for older adults who are so isolated due to COVID, and now I have so many more ideas for topics. Ruth, we're delighted. That makes our day, because that was what Chelsea and I really were aiming at. And something I wanted to say, Chelsea and I only looked at 2 journals. Our findings are not representative of all FCS journals or all journals that cover gerontology content. So,
Sarah, can I make a comment about that?
this chair rocks.
The author of that, Ashton, she called me. She saw something that we were doing here in Illinois related to ageism, and she called me, and my support staff sent me a message, and she goes, "This woman has tried calling you 3 times. You need to call her back. I don't know who she is, but she's some advocate and she wants to talk to you." And then I saw her name and I was like, "Why is she calling me?" And then I called Lacey, because Lacey is her fan club, geeks out on her. She's a fangirl. And I said, "Lacey, I'm going to call her back, and I have her cell phone number." And Lacey was like, "What?"
I was a little bit jealous, because I'm probably the one who introduced Chelsea to Ashton.
What is her name? Ashton Appleton? Applewhite. Yeah. And so anyway, I was like, Lacey's gonna crap her pants. Anyway, I probably shouldn't say that on the webinar, but anyway, so yes, I've had conversation with her, and she's as cool on the phone as she is on the website and her TED Talks and in her book. So just so you know, Sarah. So if you have not read the book, This Chair Rocks, on ageism, or watch her TED Talk.
Yep. And one of my favorite lines in her TED Talk, she talks about having one knee that hurts and one that doesn't. And she says something like, she blamed it on her age, why the one knee was hurting. And she's like, "What am I doing? My other knee is the exact same age and it doesn't hurt." You know? So definitely I'll put it in the chat once I drop the PowerPoint down. I can grab that thing. So does anyone have any questions for Chelsea and myself?
Thank you for joining us this morning. Thank you for engaging in the conversation. Even if you're here just to take in information, we're happy to have you here. We hope you stay tuned to future NCRAN monthly sessions. We have these the first Friday of each month. And again, I am going to pop the evaluation in the chat box. please fill out our evaluation. We love to learn from what you gain from our session, as well as if in the comments section, if there's something you're looking for, a topic, if there's something you want to learn about, just throw that in the comment section, even if you can comment about this session, or if you're like, hey, we'd love to see a session on, throw that in the comment section also. NCRAN is a collaborative group of the North Central region aging specialists across the states. We come together and kind of have this group that is trying to further collaborative efforts in the aging field. And so if there's some need out there, we will try to meet it. So, you know, just throw it in our evaluation and we'll try to make that happen in 2021. So thank you, everybody. Hopefully everybody's staying well out there. Have a happy Thanksgiving. And if you have any questions or want to reach Lacey or I, Lacey, thank you for flipping the screen. Our contact information is up there. Feel free to reach out to either of us. So thank you, everyone.
I did drop our article in the chat box. You can grab it and download it, but that it will give you expanded details. You'll be able to see more about what Chelsea and I did. We're always available in cran.org. You can go there and sign up for the newsletter, and that's how you'll get notified about our webinars.